last month, one and a half months before in Uttarakhand, and more than 5 to 10,000 people have lost their life, and the disaster was such a bad thing that it never happens with the by invitation. That is the definition of disaster. Disaster will come suddenly, accidentally, without any information, and your main power equipments are not enough to deal with that. That is the definition of disasters. So disaster management basically, what happens in case of natural disaster and man-made disaster. So I have just collected some photographs and I will show you. I know all of you are knowing regarding that things. Today is our days of sensitization. We used to get ourselves sensitized with this disaster management. And man-made disaster management, you have heard 3 years, 4 years before Ayla. You have heard Bhuj earthquake. We have seen sometime before in 2004, 4 to 6, around there is a big cyclones and tsunami. Andaman Nicobar were lost so many. So what everything that is what is that and how to see? Look at some pictures. I will show you.
Also, there was a fire at your hospital.
Yes.
Fire at
Emery, your oxygen pipe may burst. There may be fire. Your air conditioner may sometimes catch fire. All these disasters that occur in hospital regularly. In hospital setting, you may face also many disasters, like suddenly some bacteria sample supposes spills, and many patients get infected in your ward. So that is also type of small scale disaster. Like your oxygen, we have a central oxygen pipe system in all our hospital. Suddenly there will be some leakage and fire hazard. So we have air conditioner ducts going around the hospital. If it catches fire or something occurs, you may land in also disaster. Disaster not only means that it is the big ones. In a hospital setting, small disasters can occur, and you must be mentally prepared how to evacuate the patients from, in what way you can evacuate patients with minimum damage to the environment, also to the patients. So those you have to prepare. Earlier you were attending the fire drill. One AGM was there who was Mr. Chaturbedi. He was regularly teaching you how to evacuate patients in case there is a fire hospital. So these are all disasters. So now Dr. Jha will talk about disasters which we may face or we may not face, but we must be prepared to manage the disasters in a better coordinated way. Unless you have training, haphazardly, suppose many people are maybe doing the same job. So it is a wastage of time and energy. So everybody must know what in a disaster team, the specific must be there. Who will bring stretcher, who will hold the stretcher, who will ask the patient to how to evacuate. So it must be in a scientific fashion. Why training is required? Because suppose there is a fire, you may say that when there is fire, everybody will get activated and they will do. No, it is not. It is a particular training is required systematically in a particular fashion. Things should be occurring for the efficient management of the disaster. So what happens, suddenly there is a fire, everybody wants to do same job, then your disaster management is not successful. It is a teamwork. All the team members must know that what is their job, how to perform in a particular way. Okay, now Dr. Jha will start. We have a national disaster management team also. But you know, likewise now our team also failed in Uttarakhand. Failed because there was no drill. Nobody knew what to do, how to do, whose job is what. Nobody knew. So you see how the national level also things fail. So it is not that in small level we fail. In national level also people fail to tackle disaster in a better way. For 3 days Uttarakhand Chief Minister did not know how much damage is occurring around. Who should be entrusted with what job? What a thing you can imagine. So therefore we must be prepared for these disasters. Now Dr. Jha, kindly continue.
Man-made disaster and natural disaster. You just have a look for the different pictures. We are just random